Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along. We also have a slate of speakers and leaders to bring information and updates about COVID-19. Today we are joined by the Deputy Mayor of the City of London, Josh Morgan, as well as the Associate Medical Officer of Health at the Middlesex-London Health Unit, Dr. Alex Summers, and the Executive Vice President and Interim Chief Clinical Officer and Chief Nursing Executive at London Health Sciences Centre, Carol Young-Ritchie. Glad to have you along as well as members of the media, and a quick reminder that if you do have questions for those in attendance today on the virtual media briefing, just click on the text bubble with the question mark here on Microsoft Teams, and when you do submit your question, if you could indicate your name as well as your media outlet and who your question is for. Finally, a welcome this afternoon to those joining us on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio 980 CFPL, and those who are watching on the CTV London website. Let's get to the opening remarks right away, and we'll start today with Deputy Mayor Josh Morgan.
Thank you and good afternoon. First off, a very happy Eid Mubarak to all of our Muslim friends here in London and across the region. Eid al-Adha is a time of mercy and bonding. It is also a time of sacrifice, community, and goodwill. We value this time and those lessons perhaps now more than ever, given the pandemic and the especially horrific attack in Hyde Park last month. Together we have grieved, and together our hearts will mend. On behalf of London City Council, I wish our Muslim community a very rewarding and meaningful Eid Mubarak. Where COVID is concerned, I hope everyone was able to get out and enjoy having access to a number of amenities under Step 3 of Ontario's province-wide reopening plan. Things like indoor dining, movie theaters, museums, and gyms. Moving into the next phase, it also means numerous City of London facilities and services have resumed operation, including a handful today. For example, as of this morning, South London Community Pool and the Canada Games Aquatic Centre are open on a limited basis for lane swimming and aqua fitness classes. Arenas are now open for rentals, albeit with some capacity limits and other restrictions. And we're also offering a limited number of new rec programs at community centres and aquatic facilities. Registration is now open and available at london.ca/playyourway. Obviously, these are all great signs that things are slowly returning to normal. And in addition to the responsible public health measures, we know the reason for this progress is largely a result of vaccines. The campaign continues to go extremely well at the local level, and as of last week, anyone still in need of a first shot no longer requires an appointment. If you know someone who hasn't had their first shot or has delayed getting their second shot for whatever reason, please speak with them thoughtfully and compassionately. Encourage them to speak to their doctor or a public health representative about why these vaccines are not only how we enjoy a semi-normal summer, but an even better fall and winter. That's all for me, so over to you, Dr. Summers.
Thank you so much, Deputy Mayor, and good afternoon to everyone joining the call today. I bring greetings, as always, from Dr. Mackey, who sends his absolute best. On Friday, we entered Step 3 of the provincial reopening plan. This means that an increasing number of opportunities exist to gather, and indoor events and gathering are now starting to happen yet again. This is very exciting for all of us after what has been a very long 18 months. However, the pandemic is not yet over. The Delta strain continues to circulate, particularly amongst those who are unvaccinated. It is now the dominant strain in our region and in the province. The Delta strain is so infectious that over the next few months, there are two potential outcomes for us as a community. If all of us who are eligible to get vaccinated, we will successfully quench and decrease the Delta strain in our region and protect those who are unable to get vaccinated, maybe because they're not old enough or they have one of those rare medical reasons not to get vaccinated. However, that's going to require each and every single one of us who is eligible to receive the vaccine to get vaccinated. If that doesn't happen, the Delta strain will continue to circulate in our community, and over time, for those who are not vaccinated or who are partially vaccinated, they will get infected with COVID-19. And so it's really critical to highlight the importance of vaccination, and although as we move into Step 3, more opportunities exist for us to gather, that we continue to keep things outside as much as possible, to gather inside only if necessary, and to make sure that those around us are vaccinated, or that we're having those gentle and kind conversations to answer questions and encourage vaccination as much as we can. Fortunately, getting vaccinated is now easier than ever. Starting tomorrow, Pfizer vaccine will be available at all Middlesex-London Health Unit operated clinics, including MLHU run pop-up clinics. Moderna will be available at Western Fair Agriplex, North London Optimus Community Centre, and the Caradoc Community Centre at Mount Bridges, as well at pop-up clinics operated by Middlesex-London Paramedic Services. We are seeing increased supplies for both Pfizer and Moderna, which means we're able to offer both of these excellent vaccines at our clinics so that people can get the vaccine as soon as they can. There is no reason to delay. Furthermore, starting tomorrow, we are now able to have walk-in appointments available for both first and second doses at all MLHU run clinics between 9 a.m. and 5 p.m. You can still make an appointment, and we encourage you to do so, but if that doesn't work for you, come on by. We'll be happy to see you. And again, at all MLHU run clinics, walk-in appointments are available for both first and second doses between the hours of 9 a.m. and 5 p.m. starting tomorrow. The vaccine against COVID-19 is the single best thing that you can do right now for your health and the health of your community, and those particularly who cannot get vaccinated because they are not yet old enough. If you're on the fence, just consider this. This vaccine is safe. Millions of Canadians and hundreds of thousands of people in our community have rolled up their sleeves already, and the results speaks for themselves. This is a profoundly safe vaccine, profoundly safe vaccine. It's not experimental. When hundreds of millions of people across the globe have received this vaccine, it's now the standard of care and the standard of practice. We're familiar with this vaccine. It's safe, it's effective, it's gone through the rigorous approval processes. There's no excuse on the safety side. And it's effective. Essentially, the only people getting infected with COVID-19 right now are either unvaccinated or partially vaccinated. And everyone who's getting severely ill, hospitalized, or dying from COVID-19 is unvaccinated. By getting vaccinated, you protect yourself, and you also ensure that as the Delta strain continues to circulate, we'll still be able to reopen because we've protected ourselves and one another, which means that our most vulnerable are protected as we try to get back to doing the things that we want to do. Don't wait another minute. We're ready for you. You'll see more mobile clinics throughout the rest of the summer. We're delighted to see how many people have rolled up their sleeves already, but don't wait a second longer if you haven't had the chance yet. With that, I'm going to pass it over to Carol Young-Ritchie from London Health Sciences Centre. Thanks, Carol.
Good afternoon, and thank you for having me here today to provide an update on the COVID-19 situation at London Health Sciences Centre. I'm pleased to report that we're continuing to see lower COVID-19 related hospitalizations. As of this morning, we are caring for 6 COVID-19 positive patients, and fewer of 5 of those are in our critical care units. Our associated out-of-region cases have remained very low. We will share these numbers again if we experience an increase of out-of-region admissions. We remain ready to respond should we need to with our neighboring communities if we experience a surge of COVID-19 activity. We are closely monitoring and assessing our infection prevention and control measures. While we are all eager to loosen up restrictions, we must do so at the hospital in a careful manner, and we'll loosen up restrictions appropriately as time goes on. As of today, we've updated our care partner presence policy for adult inpatients. This change will allow 2 care providers to visit per day. However, only one care partner and can be in hospital at one time with our inpatient patients. Inpatients may still identify up to 4 care partners total who will be able to visit during each hospital stay. No changes are taking place with our outpatient ambulatory care visits at this time. I would like to remind everyone that we must continue to follow public public health measures, including masking, hand washing, physical distancing, and getting vaccinated as part of our collective efforts to reduce the spread of COVID-19. Thank you.
Just took me a minute to get to the unmute button there. Thank you very much, Carol Young-Ritchie, Dr. Alex Summers, and Josh Morgan, Deputy Mayor of the City of London. All right, well, we do have some questions from the media that are waiting in queue, so let's get to those right away. And a reminder again to the media, don't wait for those questions. Don't hold them back. If you've got them, submit them now. There is a bit of a delay here on Microsoft Teams, so sometimes it takes a second for them to upload. Now would be a good time to send those in. All right, let's get to the first question. The first question, Carol Young-Ritchie, is for you. It comes from Jennifer Beeman at the London Free Press. When will LHSC dismantle its Agriplex field hospital setup?
A great question. I'll just say the decision to stand down the field hospital is not done just by LHSC alone. That's done in consultation with Ontario Health as part of the region's pandemic response plan. We are making plans to do that in the fall, but again, working with Ontario Health just to make sure we have all those approvals in place and that we take it down at the right time. But overall, we're planning for this fall.
Thank you very much. Let's go to our next question. It's a follow-up from Jennifer Beeman. This one is going to be for Dr. Summers. Dr. Summers, at what point do you think it is appropriate for the provincial government to lift its mandatory rules on masking?
Thanks for that question, Jen. At this point in time, I don't think there is a reasonable timeline for lifting that provincial mandatory mask rule. I think it's critical that we continue to have masking in place in indoor environments where people are gathering, allowing for us to have more and more of the population vaccinated and fully understand the impact of the Delta variant in the midst of the reopening plans. I actually think we would be supportive of masking throughout the remainder of the fall and winter upcoming, because as we note, with that Delta strain being so infectious, we are going to need exceptionally high vaccination coverage rates. And therefore, we're going to need as many other tools in our toolbox to avoid transmission, and masking has played an important role for that. So at this point in time, I and the health unit remain in strong support of masking in indoor environments, and we will continue to support that for the foreseeable future.
Thank you very much, Dr. Summers. Let's go to our next question. It's from Kelly Wong at Global News Radio 980 CFPL. Dr. Summers, this one is for you as well. Dr. Summers, Seneca College has made it mandatory for all students and employees to be vaccinated against COVID-19 before they can come on campus. Do you think Western University and Fanshawe College should follow suit?
Thanks for that question, Kelly. Western University and Fanshawe College have shown tremendous leadership to date on all aspects of the COVID-19 pandemic response, including during conversations with us in which we strongly supported mandatory vaccination in student residences, following suit and being leaders in the province, in fact, leaders in the country in making vaccination mandatory for residents and for living in residence. We will continue to have conversations with Western and Fanshawe, again, as we further understand how high the vaccination coverage rate will rise on its own and what the impact of the Delta strain will be. One thing that is clear, vaccination rates have been a tremendous success in this province and in this country because Canadians, Londoners, residents of Middlesex County have eagerly embraced the opportunity to do the right thing for them and for their community and get vaccinated. And that's gotten us to higher rates than anywhere else in the world. But we need to go a little bit further. And in lots of instances, historically, that has required some degree of mandatory vaccination policy in order to get vaccination rates even a little bit higher. And so we'll continue to work with Western and Fanshawe around what other tools can be used in order to ensure that vaccine coverage is as high as it can possibly be so that returning to campus in the fall is safe and productive. Thanks, Dan.
Thank you, Dr. Summers. Let's go to our next question. This is a question for Deputy Mayor Morgan and also for Dr. Summers. COVID-19 outbreaks linked to London's post-secondary institutions in the previous spring and fall semesters primarily occurred as a result of off-campus activities. While steps are being taken to limit spread on campus, would the preference be to mandate full vaccinations to limit further community spread? So again, similar question to the previous one, but looking at it from the off-campus activity as being a possible source. Who'd like to start with the response? They're jumping at the chance. Dr. Summers?
I can certainly provide some context building off of my last comment. One thing that's very encouraging is that vaccine uptake in the 18 to 24-year-old age cohort has been robust. We've seen many people 18 to 24 get themselves vaccinated, and we are positioning both Western and Fanshawe to have access through their student health clinics to vaccine come this September. So for those students who are returning to campus and have not yet been vaccinated, there'll be opportunity to do so. When we look at what will be happening in the community, it's not just amongst the student population, but amongst all of us, where we are also, again, strongly recommending that businesses, retailers, et cetera, consider ways in which they can increase vaccine amongst their patrons and their employees. Again, the health unit is happy to partner with all to make sure that we can increase vaccine. What that looks like, I think, will become clear over the next couple of months as we see how high our vaccine coverage rate can climb. But as Jerry notes, in order for us to have extensive vaccine coverage this fall, we may have to look at different options along the way, but that vaccine coverage is absolutely critical. Again, I would highlight our post-secondary institutions have shown tremendous leadership throughout all of this, including in increasing the vaccination as they can, and I anticipate they'll take additional actions as necessary come this fall.
Deputy Mayor Morgan.
Yeah, I see the question as a public health question. I have nothing further to add than what Dr. Summers has said.
All right, thank you very much. Let's go on to our next question. Dr. Summers, this one is also for you. It's from Jennifer Beeman. Dr. Summers, how many walk-in appointments can the mass vaccination clinic sites handle each day?
Thanks, Jen. I'm not going to be able to provide a distinct number on it because that's not the way we're quite approaching it. So at all our mass vaccination clinics, we have we have some room available. As you know, we initiated first dose walk-in appointments last week. That did not overwhelm our systems at all. And as a result, we're very confident that this week there's capacity within the mass vax clinics to handle any volume that may be forecasted or foreseeable amongst those pursuing a second dose as well. One thing I would highlight is please go ahead and make an appointment. It means that you know you're going to get a spot. If we happen to see big lineups, we may have to book some appointments for people to come back or ask people to come back on another day. I don't anticipate that that's going to be the need, but make an appointment to make sure that you are going to get a spot if you can. We just want you to know that if walking in is better for you, please do so. It's also possible if you have an appointment in August or September or October, now's the time to rebook. It's really easy to do. If you go to covidvaccinelm.ca, it's very easy to rebook your appointment. There are appointments available each and every single day through July. So get in there and book your appointment if you have the opportunity. And I think we'll be able, given our experience last week, to handle the volume that will be showing up.
Thank you, Dr. Summers. And actually, to that point, I was checking for someone earlier today on the booking website, and there are lots of appointments even as soon as tomorrow. So if you are someone who has yet to move up that second dose appointment, you can visit covidvaccinelm.ca to take the necessary steps to get that second dose appointment moved up as soon as tomorrow.
Dan?
Next question. Oh, yes, I'm sorry.
Yeah, I just want to add to that. Like, I and all of my family moved up our second dose appointments, and the process was exceptionally easy. In fact, I was able to move my appointment up by 74 days from September into, well, 2 weeks ago yesterday. So I had the advantage of being able to move that up, and now have our 2 weeks past my second dose, when the original anticipation was I'd be waiting till September for that. So I would strongly encourage everyone to do it. It was exceptionally easy, and certainly myself and my family did so.
Thank you very much for that, Deputy Mayor Morgan, and a great reminder. And again, it is so simple. covidvaccinelm.ca. Let's go to our next question. Dr. Summers, this one is for you, and I picked up on, again, some of what you were talking about during your opening remarks about vaccination. So here's a question from Craig Needles, who's joining us from Blackburn News today. Dr. Summers, there was a significant rush to book vaccine appointments in France when it was announced that only vaccinated people would have access to public venues like sports events or movie theaters. With numbers still lagging, particularly among those in their early 30s, is it time to require vaccination to be part of certain public activities?
Thank you for that question, Craig. And certainly the decision around making vaccination mandatory for certain activities is a very live conversation, and one which requires obviously public health officials to contribute some information and other decision makers at all levels of government to also participate in that really important decision. One thing that we know is that we want to be able to follow through a number of different steps before we would make things mandatory, if that's required to get the vaccination rate high enough that we can safely return to the in-person activities that we want to return to. And that's what you're seeing happening here in Middlesex-London. We're trying to remove all potential barriers to getting the vaccine. Walk-in appointments are becoming available. The opportunity to have some degree of choice in the vaccine available to you is now happening. You are going to see expanded mobile clinics so that people don't have to travel at all in order to get their vaccine. We know that life is busy and full. There are competing priorities out there, and there's lots of reasons why people aren't getting vaccinated. It's our job as a public health unit to do everything we can to remove all of those barriers. We also need to make sure we ask and answer all the questions people might have around the myths out there around vaccines. And that's what you hear us hopefully do each and every single day. We've heard myths about concerns on fertility from getting the vaccine. We can tell you right now, this vaccine does not impact your fertility. It does not impact your pregnancy. It does not impact your breastfeeding. We've heard concerns that it's experimental. It's not. It's gone through every single rigorous process. But it's our job as a health unit and with our partners at the hospital, primary care, pharmacies, and others to make sure that we answer those questions clearly, transparently, and confidently, and we'll continue to do that. So we're going to continue to tackle all those different barriers to give people every single opportunity to make, for me, what seems like a really clear choice. Here's a safe vaccine, it's effective, it's available, let's go and get vaccinated. Once those steps have all been followed and we've been able to work with communities for whom accessing the vaccine because of language or concern is addressed, then we can start talking about whether or not mandatory vaccination to participate in certain events will be helpful. We certainly know that mandatory vaccination policies help to move the needle. That's true. The question remains, how far do we need to move that needle once we've exhausted everything else? That's going to take a little bit more time. But again, the evidence is shown, and you saw it in France. Once vaccine was made necessary to attend some of those public events, we saw a spike. I have no doubt that would happen here, but let's see if we can explore some of those other ways to reduce barriers first. And then, in discussion with all other decision makers at each level of government, we can start to explore whether or not that will be necessary. Thanks for that really important question, Craig.
And thank you for that answer, Dr. Summers. Let's move on to the next question. This one comes to us from Daryl Newcomb at CTV. Dr. Summers, it's for you. Very quick and simple question. How concerned are you that first dose vaccinations will soon plateau?
Thanks for that question, Daryl. First dose vaccinations have certainly plateaued already. And it is concerning because we need to get our first and second dose vaccine coverage probably 10% higher than it is across the entire population, and in certain pockets, significantly higher than that. So we've got some work to do. I will say I'm not surprised that things have plateaued. When we look at other countries who had a bit of a head start on us because of access to vaccine inventory, they plateaued even earlier than we did. And for that, again, I'll applaud our community for stepping up and saying, I recognize the importance of doing this. It's one of the reasons why you heard me highlight the fact that although we are moving into step 3, we need to remember this pandemic is not over. Just because the urgency may not feel there for you to get vaccinated because things are returning back to normal, the urgency is there, very much so, to get vaccinated. And so again, we are going to be using all those tools available to us to remove those barriers so that we can continue to see first and second dose levels climb and climb and climb.
Thank you, Dr. Summers. And we're just inside a little more than 5 minutes left in today's virtual media briefing, and several questions still to get to, so let's get through those as fast as we can. The next question comes to us, quick one from Jennifer Beeman for Dr. Summers. Are there lineups or waits for walk-in appointments at the mass vax clinics? How has the first dose walk-in rollout been?
Our first dose walk-in rollout has gone tremendously well. We've not had lineups as a result of moving to walk-in appointments for first doses, and we continue to have space in the clinics, which is why we've advanced to walk-ins for second doses. Like I said, make an appointment if you can, and if you're moving your appointment forward, rebook and make an appointment. It makes everybody's lives somewhat easier, and it certainly makes things a bit more predictable for you. However, we want to make it easy for people, and so walk-ins can certainly be tolerated and encouraged. For the time being, though, the first dose walk-ins went very, very well, and one of the reasons why we're confident and ready to move to expanding it.
Thank you very much. Let's go to another question from Jennifer Beeman, just looking for some more clarification on the mass vaccinations. Dr. Summers, what proportion of mass vaccination site appointments are for second doses? Are you concerned with the slowing first dose campaign? Well, we just talked about that plateauing a bit, but do we know how many of the appointments are set aside for second doses?
Thanks for that question, Jen. We actually don't set aside appointments for first and second at this point in time. We consider the appointments as vaccine appointments on the whole. We certainly monitor which ones are first and which ones are second, but we're not in a position where we need to divide it up that way at this point in time.
Thank you very much. Let's go to the next question is a follow-up from Daryl Newcomb. Dr. Summers, by telling the public where Moderna and Pfizer are being offered, do you know how that will encourage those who are vaccine shopping to get a first or second dose?
Thanks for that question, Daryl. The first thing I want to say ever so quickly, and you've heard us say this multiple times, is we have two exceptional vaccines readily available for us, and they are equivalent with regards to their safety and efficacy. I'm a Moderna guy because that's what was available when I went and got my vaccine, and I would have taken Pfizer, I would have taken Moderna, I would have got my loved ones to take Pfizer or Moderna. They are equivalent vaccines to me. They are interchangeable vaccines to me. They are safe. They are effective. Truly, there is no discerning between the two of them. However, we do know that some people have developed a bit of a preference for one or the other, and we do not want that to be a barrier to you getting vaccinated. So as I mentioned, we want to be transparent as we can. Our inventory has improved, and we want to remove any questions you might have to getting vaccinated. So for those of you who have had concerns about vaccine and for whom my reassurance doesn't necessarily do the trick, yes, we have Pfizer available at all MLHU operated clinics. Moderna is available at Western Fair Agriplex, North London Optimist Centre, and the Caradoc Community Centre at Mount Bridges, as well as Middlesex-London Paramedic Service pop-up clinics. Both of these vaccines are absolutely exceptional. Don't delay for anything. Now's the time to go.
Thank you very much for that answer, Dr. Summers. And just the last question is from Jennifer Beeman. And I think, again, just looking for some more clarification on that news today that where certain doses of vaccine are available. So Jennifer is looking for clarification, Dr. Summers. When you said Pfizer is at the mass vaccination sites, do people have the choice between Pfizer and Moderna now?
To the best of our ability, when the inventory is available, and we anticipate that it will be, there will be an opportunity for Pfizer or Moderna. As I mentioned, if you want to join Team Moderna, I encourage you to do so. But we will, again, want to remove any barrier for people with regards to getting their vaccine. And so, again, at all of our facilities, Pfizer is available, Moderna will be available at those three that I mentioned, plus the pop-ups with the Middlesex-London Paramedic Services, and we will do our best to make sure that somebody walks out of there with a vaccine. That's our goal. We want you to get vaccinated, and we will do our best to make sure that that can happen.
Thank you very much, Dr. Summers. And that does bring us to the end of our questions, pretty much right on time. A reminder, if you have not yet booked an appointment, you can still book online at covidvaccinelm.ca, or also to move up a second dose appointment that is already scheduled, maybe in August or September or October. Get that second dose as soon as you can to get protected sooner. And hopefully, as Deputy Mayor Morgan was talking about, getting back to those activities that we all miss so much. You can also, by all means, walk in to one of our walk-in pop-up COVID-19 vaccination clinics or visit any of our mass vaccination clinics between 9 a.m. and 5 p.m. That does it for this afternoon for today's virtual media briefing. We will be back with our next virtual media briefing. That is coming up on Thursday, the 22nd. We hope you will join us then. So between now and Thursday afternoon, have a great rest of your day, and so long for now.